the thought? Rest of it goes, distributing. Anything left.
Oh, you got the old firmware up there.
I don't like the way my,
Yeah, you did, and I.
Very light, or I just can't see it for.
Join me for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, Mr. Chair.
Good morning, everyone. As we are here on the 20th of December for this meeting of the Morrison County Board of Commissioners. Gentlemen, you see the agenda in front of you. Is there any additions or deletions?
Second.
We have a motion by Commissioner Wincher, a second by Commissioner Jelinski to approve the agenda as presented. All those in favor signify by saying aye. Aye. Those opposed, the agenda is passed. Gentlemen, next on the agenda, we have employee recognition. We have a new employee.
That's correct, Mr. Chair. I ask Brian to bring Elizabeth forward, please.
Good morning, Mr. Mindorf.
Good morning.
Morning.
This morning I have the pleasure to introduce you all to the newest member of my office, Elizabeth Zebarth. She actually started back in July, but I've been a little delayed in getting in here to introduce you to her. She handles the misdemeanor prosecution for my office, part of the misdemeanors. She does the gross misdemeanor prosecution, and she handles some tax court appeals. So, Elizabeth, would you like to tell the board a little bit about yourself?
Sure. Hello, everyone. My name is Elizabeth. I moved here from Minneapolis in 2020, right in the middle of the pandemic. That was fun. I worked for Judge Wetzel for about a year and a half before Brian made me an offer that I couldn't refuse. And I've been very happy here for the last 5 or 6 months. It'll be 6 months on January 5th. And yeah, I'm very happy to be here.
Fantastic. Welcome, Elizabeth.
Thank you.
Board.
Thank you.
Gentlemen, comments? Commissioner Jelinski.
I've actually had the pleasure of meeting Elizabeth in a different meeting, a little different setting than this. So her face is at the very least welcoming and recognizable. So I'm thrilled that you're here.
Thank you.
Anyone else?
Thank you for being
welcome
here.
aboard.
Yes. Yes.
And next time, Brian, maybe chop a little
I
earlier.
knew that was coming.
Yeah, I
Yep,
will.
knew it was coming.
All right, thank you.
Elizabeth, welcome.
Thank you. Merry Christmas.
Yep.
Gentlemen, next on the agenda is the consent agenda. I'm going to ask if there's anything on the consent agenda members would like to have pulled for further consideration.
Chair,
Commissioner Lemire.
I have 5.9 taken out of the consent agenda to be voted on separately.
You certainly can. Gentlemen, anything else that you would like to have pulled from the consent agenda for further discussion? Seeing nothing else,
Make a motion to approve, Mr. Chair.
thank you, Commissioner Lemire. Motion by Commissioner Lemire, a second by Commissioner Wincher. Further discussion, further discussion. Seeing none. Gentlemen, this is a roll call vote. Commissioner Wilson.
Aye.
Commissioner Lemire.
Aye.
Commissioner Wincher. Commissioner Jelinski.
Aye.
The chairman votes aye. All those voting in the affirmative, the consent agenda is passed. So would we like to go back to 5.9 for further consideration? Gentlemen, this is a resolution seeking approval for the benefits change for our non-union employees.
Mr. Chair.
Mr. LeBlanc.
So as highlighted, this resolution is a request for non-union benefits to be applied to the, for benefits to be applied to our non-union employees. 2 weeks ago, I think it was, the board passed for our non-union employees to receive a 3% COLA for 2023, as well as the 2 additional steps on the pay scale. And now, what I'm bringing forward to the board today are some of the other ancillary benefits that were negotiated with the union groups. To date, we have 3 union groups that have ratified and signed their contracts, and 2 union groups that have received the red line version that they have tentatively approved. And now it will go through to make sure all of the adjustments have been captured properly and then to be signed. So with that, and to stay consistent across the county staff, some of those benefits do apply or could apply to non-union employees. And today I'm bringing forward 3 of those items to be added to our personnel policy for our non-union employees. The first is to address Article 32.01 in our personnel policy, stating that the county will recognize Juneteenth as a holiday when adopted by the state of Minnesota. Article 39 is a 1% adjustment in the lump sum payment for a longevity pay beginning at year 15 and every 5 years throughout. So an employee who achieves 15 years of service would receive a 2% lump sum of base salary, then 20, 25, 30, and 35 would receive a 3% lump sum. That's a 1% increase from previous years. And Article 34.06 is a deferred comp adjustment. The bands and tiers were adjusted by the board and offered to the union. Most significantly was a top-end increase where an employee who contributes $125 or more, that the county would match with $35 into a deferred comp program.
Thank you, Mr. LeBlanc. Gentlemen, questions?
Mr. Chair, I'll move on this.
We have a motion by Commissioner Jelinski,
Second.
a second by Commissioner Wincher to approve these benefits changed for non-union employees. Discussion.
Mr. Chair, I'll be abstaining from this because my wife is a non-union employee.
Very well.
It'd be a conflict of interest for me to do so.
Thank you, Commissioner Lemire. Further discussion? Further discussion? Seeing no further discussion, this will be a roll call vote. Commissioner Wilson?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Wincher?
Aye.
The chairman votes aye. Commissioner Lemire will abstain.
Abstain.
All those voting in the affirmative, this motion prevails. Gentlemen, at this time, we go to back to our agenda to the Health and Human Services report. We have Brad and Melanie with us this morning. Good morning, Brad. Good morning, Melanie. Good to see you.
Good morning, Commissioners.
Morning.
Morning, Brad. Good morning, Melanie.
Melanie.
We're going to talk a little bit about children's mental health case management. Melanie supervises this group, and it's so I asked her to put together some information for you. So I'll turn over to Melanie.
Thank you. I really wanted to give an update on our caseloads, but also the initiatives that we're moving forward, particularly to deal with the increase in mental health needs in our community, and actually that's kind of nationwide at this point, as well as the new funding sources and partnerships I'm exploring in order to help reduce our out-of-home placement costs that continue to go up. So as you know, Children's Mental Health Services is a voluntary service, and we do serve youth that are 0 to 21. They have to have a serious emotional disturbance as diagnosed by a mental health professional in order to qualify. There certainly is a range of disabilities along that continuum, and the next slide really shows our continuum of services that we have and have been trying to expand upon. One of the newest services on our continuum of services under case management is CIBS, and that's Collaborative Intensive Bridging Services, and that's a service we've talked about before. Initially started with a Sourcewell contract and also supported by some ARPA funds in order to get that in-home therapist that took so very long to get. In addition to that continuum, as you go further down to more restrictive, more serious services, we have the 35-day residential assessment eval, and as you'll see as we get later on the numbers, that is a cost that's been impacting our agency at a great rate, as we have limited access to thorough assessments in the community with a decrease in availability of mental health and neuropsychological services. So that is one area we're talking more about. In addition to the CADI waiver services, which is a federal waiver that we've been using to support families to keep them in the community and in the home. So that has actually expanded quite a bit as well as we're trying to decrease those residential stays. So as I mentioned, the next slide goes into some of our challenges, and I've already kind of visited a little bit on some of those. Our limited resources in the community for in-home family services has been a big component that's been drastically different than I remember 20 years ago. We had a lot of in-home support. In-home support is very crucial for families that are working and have kids in school and can't be taking off time to go to appointments, and so the therapist coming into their home and to address the family issues within their home is really important and very effective as proven, but it's been hard to come by, as well as having a lack of medication management providers. Respite care homes are essential, and that has been super difficult to find foster parents that aren't full with child protection cases or that are willing and to deal with some of those mental health issues that kids have and have an understanding of that. We have long wait lists right now for assessments, and autism services have increased by about we're up to about 15% of our caseload now is autism specific, and that is a new phenomenon that used to be primarily served in developmental disabilities, and now our mental health system is dealing with that as well. And so we have long wait lists to get assessments and long wait lists for services once they're deemed accessible. Northway Academy and Autism Matters have probably wait lists of about 6 months out. So it just seems like a lot of our families are struggling with issues. They know that they want assistance, and it's been kind of an effort to try to figure out how to get them assistance when they want it so that they can have their needs addressed. I mean, we do have youth reporting more traumatic events. We have at 8% nationwide, youth 3 to 17 are diagnosed with anxiety. And I think it was the Surgeon General who was saying that, this is a public health crisis. I mean, that we need to address some of the anxiety needs of our youth. And suicide is the second leading cause of death for 10 to 19 years of age right now. So that is an alarming thing for us to think about. As a part of our suicide cohort, I've been doing work with that too, and learning about suicide interventions and preventions, and looking at the most recent data I can get from the Minnesota Student Survey right now is 2019. And the next two slides kind of show how the increase in stressors for youth is impacting them. I just want to mention that youth report long-term emotional behavioral needs. Long-term in that study or within that is 6 months or more. So that's what long-term means to youth, and that kind of fits, doesn't it? Yeah. So as they consider suicide, and we've seen that increase, as well as they report they have behavioral needs. And then the next slide, in youth suicide, the youth that consider suicide and youth that attempt suicide both have gone up. And of course, our efforts in the suicide cohort really want those lines to come further apart. That will be our goal, that we have less youth attempting when they're considering suicide, that they can reach out and find some assistance, and they know where to get that. Youth with long-term behavioral needs, we of course want those lines closer together. When they report needs, that they're able to receive treatment, and then we're working on initiatives in the community with screening and access to services to help bring those lines together. The next slide just shows our increase in caseloads that we've experienced in children's mental health. Right now we're at the highest, and that's a to-date number, and I think I've added a couple cases since then. So we've been doing some work internally. They've been managing cases at over the caseload threshold that we wanted them to, and doing a really nice job of trying to meet those needs and cover those cases, even though the demand's been quite high. The next slide is about voluntary placements, and that's something that, you know, I need to watch carefully, and we need to be aware that there's this gap between families that are feeling in crisis and want help and are afraid for their kids and want intervention, and then knowing that pulling kids out of the home and having them reside someplace else is also a traumatic event. And so we do have screening teams in process, we have the screening team in place to help with those decisions, make sure that's really what's needed. But I do have to say, you know, we've had this increase in voluntary placements, and many of the placements that we are approving at this point have to do with suicide ideation. And so it comes down to this safety factor, really, that you're trying to address. And parents not feeling that their kids are safe at home when they go to work, and really worried about the number of times they've been in and out of the hospital, and that's got a lot to do with this increase in placements that we're seeing. The next slide just shows the different lengths, and this is residential placement only, so that's a facility, and that's usually Bemidji, Grand Rapids, Duluth, those types of areas. They're farther away. And so we are trying to use those 40 days or less. Those are those 35-day evals. So try to get a crisis situation addressed with medication monitoring and having an opportunity to have a good plan, and then get those kids returned home with services. We have some kids lingering on longer, and then we have, 3 kids that are in residential, that were in residential, and 2 are still remaining. So we try to watch and carefully monitor, why are we keeping kids in a facility that long? Are they making progress? Is it necessary? And so try to really screen for that, because it is such a disruption. The next slide is just, these are things that I track. I look at our numbers over the course of time, and this is for not only the kids served in mental health, but also our state ward and child protection clients. And we do have some state wards that have some pretty complex mental health issues, and so we do have kids that are residing in residential settings at a higher rate, taking into those account as well. So. And we also have kids entering extended foster care that have come out of our mental health system too, and we're seeing pretty good success with those kids and providing them extended supports, being able to get jobs, successfully live in their own apartments, because we are continuing to provide those services. The next slide talks about, those factors that I can influence on that out-of-home placement chart, and that's voluntary placements with intact families and truancy, and then looking at that difference with state wards. And we do have those high-need state wards that are residing in residential care. We do try to readjust them to the community, and then unfortunately, we've had several of them that just are having a hard time living in a family setting and are requiring residential care. Our Caddy foster homes provide a great service for our voluntary intact families, and that they are in the community here close by and in a family-like setting, and the family participates in parenting along with the staff at the foster home, which might be owned by another, like as a business or as a family home. And the next slide just talks about those initiatives that I've been using to try to address the increased needs. Again, I mentioned collaborative intensive bridging services. The behavioral specialists is what we had, the board had approved with ARPA funds. It's increased staff at schools in order to address the greater mental health needs, and the hope is with that, as there has been a study done by the U of M that looked at school-based services recently that came out and really talked about the major impact that has, and like this initiative that the board supported has, in getting those kids into services sooner. So they don't have a full-blown mental health crisis. That early intervention and getting them connected to services has helped decrease that further end, that later end need. So that was positive to see that study come out after the board had approved the ARPA funds, so. We're also working with this Big Idea grant. It's an additional grant from the state to increase positive supports from kin and family. Family Support Grant has been a huge source of support for our families, and that it's a grant that helps them meet their kids' needs in their home, as well as Caddy Waiver, increasing family training service, working with a local provider. So we have services for kids that are paid for by the Caddy Waiver that's very intensive while they reside at home. And then we do have the Caddy Group Residential Placement that just opened up in town, so that hopefully will divert some of those needs for long-term residential care, and those kids can be served more locally with the support of federal dollars. And then our truancy intervention, I also supervise truancy, and the longer I have done that, the more I have learned it is a mental health program, because most of the time, kids aren't going to school because they have a mental health issue that's been undiagnosed, and so we've been working hard on that.
Just one other initiative that's not on there, which goes with the first bullet too, was the ARPA dollars approved to enhance their payments for in-home. So we did get a in-home therapist
Yes.
as a result of those ARPA dollars, who was working specifically with Morrison County families, so.
If we would not have had that, we would still not have a therapist for that. So, made a huge difference, yes. The early intervention that I'm talking about with truancy is the next slide. And just, we have Logan, who does our primary group intervention. So after 3 days of unexcused absence, they have a contact, and we also have a contract with LSS, and Greg does that work with Logan. And so they have contacts after 3 days of unexcused, and then it goes up to 7, and they have an intervention group. And then after that, if they don't go to school after that, or don't have their issues addressed, then they get deferred to Casey, who does truancy case management. And I just have been so impressed with how this program is working out as we're kind of gathering these statistics, and that those AIM contacts, that's that first contact after 3 absences, and then the truancy diversion group, and how much we're able to divert from long-term case management. And so those kids are getting referred to mental health services early on if they need to, or they're working with the family to correct the issue, and so we're getting kids back into school by and large part. Those kids that come into Casey's caseload for case management, most often we're connecting them with mental health services in the long term. So it's just taking some patience, but it's a lot better approach than we used to do, which was a more of a correctional approach that was punishing. So happy with that. The next slide just shows our Caddy case management and services, how we've been increasing those. Again, that is supported by federal and state dollars rather than local county tax dollars. So it not only is it an intensive services that meets families' needs, that's person-centered, but it also is supported by state and federal government. The next slide does show the increase in funding that, I've been trying to focus on bringing those dollars in to provide services. And the Family Support Grant is a lower line there, but that is those $3,000 grants that go to families in our community, and they work with the case manager to decide how they want to use those funds in order to support kids to keep them in the home. The kids have to be in their home in order to access it, and so we've steadily increased that funding support.
And that's a testament to Melanie and the work she's done with the state on continuing that and supporting families, so it's been very appreciated.
So the focus areas, I just ending with here for 2023, and I've kind of already mentioned them. It's that continued work with the suicide cohort to try address our youth suicide rate, and our also looking at screening opportunities and working with our community to make sure we're doing our social emotional screenings and making sure we're working with our community partners to screen for mental health issues and get them referred, increasing our Caddy services, and then the exciting possible partnership that's coming up with Fraser. Well, we've been working with Fraser for over a year in a partnership.
Yep. So just to comment on that, UCare, one of our health plans, hooked us up with Fraser, and so we've been meeting with them about once a month. As Melanie talked about earlier, just the increase in autism cases, that Fraser really specializes in autism and is pretty well known in the cities for the work they do. And so because of what UCare did and what we've done here, we're hoping that we will be having some added services that will support our families. So It was pretty exciting to get hooked up. UCare did a great job, Fraser's done a great job, and we'd appreciated the partnership.
Yes, yeah, looking at some possible initiatives to bump up that screening time or that assessment time, so families aren't waiting so long, is what we're hoping for.
And not making them drive to the cities
Yes.
for 2 to 3 appointments.
Questions? Commissioner Wilson?
Melanie, I noticed on one of the first couple slides, caseloads were down, like in 2020, we're down to like 160 or something there. Is that because of COVID? I guess I'm trying to figure out
Yeah.
how COVID worked in this.
Oh, definitely, we had a,
When we had COVID, and were we working with these people, were we not? And then the following year, in 2021, I see even with the school stuff, where it went up quite a bit. So is that kind of a combination of COVID and?
And I would say schools being out too, because a lot of our referrals come from the schools. So families were isolating, and
Yeah, we
it changed the
it
dynamic.
was the new cases coming in, really, that influenced, and, you know, early on in that time frame, I mean, things were just really quiet and intake, and there wasn't much happening. You're right, families were home, and they weren't seeking out new services via telehealth at that point, because that was all pretty new. It's surprising how many years it, already 2020 goes back to, but yeah.
Because I would just say if that wasn't COVID year, that would probably be up in those 170s caseload like,
We probably have less of a sharp curve.
yeah.
Definitely, and, you know, and maybe some of those in 2021 would have actually come in 2020. Now, this factor of this increased anxiety that we're seeing now, I know the comment is that COVID related? I suppose it could be part of that, but I think there's another phenomenon, you know, happening with social media, is my opinion. It's not based in science.
No data to drive that, but certainly
There's
impressive.
probably some I could find, but you know how that goes.
Thank you.
Thank you so much.
That was actually kind of a question I had, you know, you had highlighted or made us aware of the youth anxiety and then the youth suicide and the corresponding numbers, but it begs the question to be asked, so what are these, you know, what are these youth anxious about that are causing us to have to respond with mental health services? Have we been able to identify, you know, an underlying cause of this anxiety out there?
I'm certainly reading just about everything that comes across, you know, so that I can, you know, because that's part of what they're studying right now. I mean, they're trying to get to the bottom of that. And so I've seen articles that address the social media, yes, with that real-time, you know, feedback of whatever, and then the access to everything that comes on your phone, which is reports of news and worries about climate change, worries about political strife, worries about school shootings, worries, you know, if you turn on the news and then you think about what gets pushed through without very much filters on social media, I mean, and then you don't have the brain capacity, and I don't mean that in a negative way, I'm just saying that, you know, it's an undeveloped brain that's trying to process all of that. And so that's what I've been reading so far.
So that's what we read in information that's sent to us throughout the profession. So does that line up then with, I'm looking at the screen here where we have 192 cases in our caseload for 2022. So when we look at the people in Morrison County that you and your staff are dealing with, does that correspond to what you just shared with us about what you read? Are we seeing that? Are we seeing the same things? I'm interested in the drivers
Yep.
of the people that we're serving
Yep.
here.
I would say it is the social media aspect, the peers, the peer pressure, the peers that they feel, that's what's been reported. Significant changes in behavior when they're hospitalized or away from their phone as to when they get it back. I've heard many And these are anecdotal, but this is what is being reported, yep. Anxiety in a way that kids can't really identify it or describe it or understand what it is or how to cope with it. And so that's so much part of what we provide in mental health services, helping them understand what that is, what that feels like, how do you calm yourself down, how do you take a break when you need to, a lot of focus on coping skills. And, and then we have, kids in our system. We also serve in that 192 is also that increase in autism. It's also kids that are coming out of the child protection system at a greater rate and going into permanency and adoption or maybe return back home that have had traumatic events, increased drug use in the home that has caused some of those traumatic events, so kids that we're serving. So, those are the factors, I would say, locally that drives that 192 number.
It'd be interesting, and I'm not going to ask you to give me that number now, but it'd be interesting to see the percentage of that 192 caseloads that's coming from single parent or no parent families out there, because I'm assuming then these children aren't getting a lot of support from parents, or there may be a lack of understanding how to respond by parents if there is a parent in the home for these children to help address these anxiety attacks or anxiety issues out there.
Well, and I think part of it too is parents are just as anxious as their kids because they've had to deal with COVID. They might have been staying home. They had to be their kids' teacher for a year and a half, which, we're not accustomed to. So, and to some degree, kids, replicate what's going on with the parents. And we've seen it throughout during COVID, just the anxiousness of all of us having to deal with COVID. And so and when I said before, families were isolated, not necessarily a bad thing, but it's certainly, we love our kids, we love our spouses, but the more we can't go anywhere, it just creates that anxiety as well. So, so I think it's a combination of all of those things.
Do you see that trend changing then? Because now I look at it as we're like a year out from that set of circumstances where we have children learning from home, we have parents at home because of COVID and things like that. And now I kind of look at the situation or the circumstances now that COVID, for the most part, is in the rearview mirror, and most of society is kind of returned to what was the norm prior to the pandemic. Do you see those trends then changing now back to pre-pandemic or not?
That would be the hope, right? That's our goal. That's what, we're doing those assessment, early intervention services. So part of me thinks to myself, so there was a lot of kids that were, at home and we weren't identifying them. Now we've got this increased assessment period and we're identifying kids and we're getting them into services. I would hope that would make that, curve. We would round that corner, so to speak. That would be the hope. That's why having, access to so many more community supports other than just us is so important. I also feel really strongly about it's okay to talk about mental health. It's okay for parents to ask for help because that's when we see the best success is when we get involved early and can address things and close the case. Get families set up or, the worst thing that can happen is kids and parents not talking about it and just trying to hold it together because that's when we see, of course, those deeper end situations happen with suicides and also the need for residential care all of a sudden because they're arrested or they're at the hospital. So You know, my hope is that we can come to a place in our community where, through the suicide cohort, it's okay to talk about mental health, it's okay to talk about, and I'm not doing right now, well, right now, I can get some service, I can handle this, I can get back on track. That would be our goal, is that we would kind of round this curve of this increased need and make it okay, like the, you know, slogan is for suicide prevention, make it okay to ask for help. And get the help you need and get back on your feet and go.
And for some, COVID was a traumatic event. And so it takes time to overcome trauma. You know, you think about a classroom closing down because of illness. You know, you've seen it this school year with the flu and the RSV and the COVID. So that brings heightened sensitivity to those who are already worried about COVID or have that trauma about COVID. So it will take time. Trauma takes time to overcome, and hopefully with the additional services and the partnerships that are happening, we're going to help bend that curve a little bit.
Thank you. Further discussion, Commissioner Wincher.
Yeah, again, I know this is probably a data thing, but again, from 21 to 22, you're not getting 192 new cases, or are some of these of the 176 part of that 192?
Oh, yes, yes.
See, so that's,
Yes.
you know, it's not like we're getting 192 this year because it is a carryover.
There is a carryover,
But
exactly.
My big question
We
is,
close and open during the year.
when you say that they time out or whatever
Mm-hmm.
the word is, do we keep track of them children after they turn 18? I think that's so important, and maybe we can't do that. What is their goal in it when they turn 21? I mean, and how far can you go? But, you know, I think that's important. That would tell us that it's working, you know what I'm saying? So
Exactly.
if they all go back into drugs after they get off, whatever it happens, then I don't think it's working. But to me, that would be something that I would like to see the data eventually.
Yeah, we don't track kids for years and years. What I would say is that with our partners, corrections, mental health center, law enforcement, we kind of know some of those kids that we've worked with and have not been successful. And I wouldn't say it's the majority. There are, so, but it's anecdotal again that, you know, we just couldn't track all those
And then my
kids.
last question is, again, I feel to my heart that's very important too, is do the parents get involved with these children when they are maybe at the school, they're saying, hey, you know what, your child needs some help? Do you see a lot of parents or grandparents helping out, you know, or is it kind of like, you know what, they're coming from a broken home or whatever?
You know, you remind me of something that was important to point out. In order to have a children's mental health case management case, a parent has to be involved. We can't have a case open with just a child that's living in a home if the parent doesn't meet with us and won't become involved. We'll end up closing those cases because we don't have a partnership. So yeah, it requires a partnership. And of course, every parent has greater or less capacity depending on their mental health condition, their work schedule, you know, or whatever situation like that. We meet them where they're at, we work with them in partnership, we help them understand how important they are to their kids' recovery, because they really are. And our staff has done a lot of work on training with trauma-informed care and validation, and some of those initiatives that help with communication to engage parents, rather than, you know, fight with them on an issue, help them understand and feel valued. And I think that's been successful also at retaining some of those cases. And working with them longer to have a successful outcome.
Appreciate that information, thank you.
Commissioner Jelinski.
Thank you. Melanie, right at the very start of your presentation, you talked about a 35-day residential assessment. Briefly, can you tell me what that means? And does it start is this at the home, or where is this? If you
I
could
wish
just
it was
briefly
at
say.
the home.
Okay.
That's kind of would be my fantasy
Okay.
if I could get clinicians, because that's all you'd need. But because you have to have specialized clinicians, which is a medical doctor, a psychiatrist, and then therapists, that's why kids go to a facility for that. And so those facilities are in Grand Rapids, Austin, and Duluth, basically. Yeah, and so they are studied for, you know, how they're residing, and it's kind of like a dormitory kind of setup, you know, and it's It's a residential home.
And that,
And when they leave, there is a plan. So what do the parents need to do? What does our agency need to do to provide support? What does the community, the schools? So it's a pretty comprehensive plan that the child leaves with in the family.
Yeah, and, you know, sometimes defining a diagnosis, and I didn't mention this, but that's kind of one of the most paramount things for kids and children's mental health, is what is the diagnosis? What kind of treatment path are we going on? And I've seen a big change in that, you know, we're treating kids with anxiety and depression, and also we get an autism diagnosis, and we line up the services, and all of a sudden they're making progress. It's that diagnosis is so important to understand what kind of treatment plan we have to have. And so sometimes we end up having to do that 35-day eval in order to get that right diagnosis.
so you have the 35-day eval, and that gives you direction as to, hopefully it gives you direction
Yeah.
as to where to go then. And my last thing is going to be, you talked about a wait list, a wait list of 6 months. If you have an autistic child, or whatever the other cases, trillions of different things, it's almost like a lifetime.
Oh, it's a long
6
time.
months, I mean, is, wow, that's a long time. And I really don't know how you fix that. I mean, because if you said, well, we'll fix that by hiring one more social worker, mental health worker, well, then are you gonna hire one more nurse, one more doctor? I mean, it just goes, I don't know what the fix is, but that's kind of,
Well, and
that number
workforce-
blows my mind.
Yeah, and workforce is an issue because there are some facilities that aren't at full capacity
Yeah.
because of workforce. So they have more beds, but not enough staff. So, it creates that challenge too.
And, you know, we are talking with Northway Academy about a Little Falls office. And, you know, will that happen for them? I don't know. But if they could get enough clinicians, like you're saying, which I'm sure is part of it, in order to open up more, yeah. And it's that higher degree of, that does a neuropsychological assessment. So that's a very specific, and of course, there's fewer of them.
Excellent, thank you both very much.
Commissioner Lemire.
I just want to say, it's always nice to see you, Melanie. You always give us some good information. I
Thank
just
you.
want to say thank you for always looking at new ways to help children, and I love to see your passion, and we appreciate your work very much.
Thank you very much. Yeah, appreciate that.
Thank you, Melanie.
Thank you.
Thank you. Merry Christmas.
Thank you.
Thank you both.
Same to you.
Gentlemen, next on the agenda, Sheriff Larson's here with his monthly report. Morning, Sheriff.
Good morning, Sheriff.
I'd like to approach, if I can, and just give you a newsletter.
Please.
Basically, what this is, I just kind of extracted the information out of the monthly report and put it in a little bit of easier format to review and read. And because I got the report and statistics late Friday, I had to kind of do this over the weekend and yesterday, so I apologize it wasn't to you any sooner, but I think the factual information's important, and I think having it in front of you and laid out in this format might be a lot easier to kind of comprehend and follow along. So with that, I'll just go over the month of November. We had 1,014 total complaints. 76 were classified as criminal, 938 were classified as non-criminal. And of course, that included all of our traffic citations. When you look at our report and we look at those pie charts, we had 22 theft complaints and 14 damage complaints, damage to property complaints. So that's kind of what led in that category. We had 299 traffic citations. 222 of those were verbal warnings, 17 speeding citations, and 25 written warnings. I note that November was a busy month. We continue to join training with all of our municipal police departments within Morrison County, which is good because we all kind of pretty much back each other up and go on calls together. So we should train together and be on the same system, which we are, and we have the same trainers. So in November, we did no light and low light inclement weather handgun and rifle qualification. So that's an annual training that we have to do it once a year, and everyone has to qualify. And We kind of put the two in one training. You know, it's somewhat cold in November, and of course, it gets dark earlier, so we just do the same training, two trainings in 1 month, but we join them together, if that makes sense. And of course, this is post-mandated, which is Peace Officer Standards and Training, and that's why we do that qualification shoot. Moving on, as far as our jail, we've been really busy. We've averaged 35 inmates for the month of November, and that's just Morrison County inmates. But then we brought in and boarded inmates from Itasca, Beltrami, Aiken, and Grant County. So kudos to our jail administrator for reaching out and continuous communication with these other counties and trying to figure out, you know, are there any inmates that we can board? Because it is a nice little revenue for us. You'll see that we collected $19,414 for boarding out-of-county inmates for the month of November. Chaplaincy program, I just kind of highlight that. He's been here for 20 years. He continues to do a phenomenal job. He is busy with everything. You can imagine just when Brad and Melanie were talking about the mental health and suicide and drug use and everything else. That's the arena that he's involved in. He gets called daily, nightly, around the clock. I've been with him on calls at night, and his phone is ringing just as much as any of ours. And it's, hey, my child is, you know, depressed, and they're talking suicide. Are you able to assist? Or a subject got arrested, and he felt like he needs someone to talk to because now he's contemplating suicide. So those are calls he's fielding all the time. And again, around the clock, he's providing those services. So he continues to do a good job. Out of the last 40 years that he was a clergyman, he said that this year, by far, within the last year, has been the worst when it comes to mental health aspect and suicide and overdoses. So it's just kind of from his own words that what he's seeing. We did have a chaplaincy fundraiser. That was November 27th. I'll just highlight that it is a 501c3 nonprofit program. So 1/3 of his earnings comes from the county. 2/3 of his earnings for the chaplain position comes from raising funds. So we did bring in $5,601. It was held at the VFW. Domino's supplied the pizza, and we had a really good turnout. So we're just thankful for the continued support for the program, and this is what keeps our chaplain going, and he's definitely needed. So just wanted to highlight that. Now we'll kind of switch gears and go to drug trends. And again, I'm just extracting things that I feel are important. Some are in the monthly report, and some I'm just highlighting, and I think we need to talk about. So the drug trends, we continue to post on social media, really the current trends and what we're seeing in our community. We've been seeing a lot of these, they're called M30 pills, and I kind of talk about it here. Some are fake OxyContin, but they're laced with fentanyl. And some of these pills are pure fentanyl. And of course, we don't know until we send them to the BCA. They do their lab studies on them, and it could be months. But this is kind of what's been going around and that what we're suspecting. Unfortunately, we had 2 overdoses, which resulted in deaths in the last 5 days. So it's bad. It's really bad. And it's to the point where, okay, we look at what are we doing and what can we do differently. So I've reached out to our representatives. I think we need harsher laws in place as far as these sales go, because right now you can sell 10 grams of heroin and it's a first-degree sale charge. You can sell up to 50 grams of fentanyl for it to match as a first degree. So that's a big difference. Now, I don't have all the answers. I don't know what has happened. I think early on we had a lot of heroin that was laced with fentanyl, and we weren't dealing with pure fentanyl. So maybe it wasn't like high on the radar at that point. But now, instead of it being laced, the drugs that we're running into being laced with fentanyl, we're running into a lot of pure fentanyl. So maybe it just takes time to catch up, but we've been vocal about it. Law enforcement's been vocal, the MSA, Minnesota Sheriff's Association, we've been vocal. We want change. We want stiffer penalties. So I kind of highlight in there what we're seeing and the current trends. And so take time to please read that, if you will. Again, the overdoses are a problem. So, of course, we make a call to the Drug Task Force, and we're basically, I'm talking to the commander saying, swarm this area, do what you need to do. Here are some names that we have. Let's nip this in the bud. And that's what's going on, and that's what's happening. So good things are happening, but yet more people, it's so bad that it seems like it's reoccurring way too much. So of course part of the thing is we want prevention. So, we can talk about enforcement, education. So we do have some organizations that can assist. So we list that and we put that public as well. And the biggest thing is what we're telling people is, even if you got to call me directly or call the chief of police directly or someone that you trust, we will not be judgmental. We want you to get help. We want you to succeed. If you came into our office or my office and you said, hey, I need help, I'm going to make sure that I guide you through and get you from point A to point B, no questions asked. And that's what we want. We want people to realize that there's not going to be a stigma. We're not going to judge you. Let's just get you the help, because really, you got to want the help yourself. And until you step up and take accountability and want that help, it's going to be tough to help you. So some interesting drug statistics. I mentioned this. So I reached out, Little Falls Police Department did their own statistics from April 6, 2021, from December 14, 2022. So we being Morrison County Sheriff's Office, looked at that same time frame, and we looked at how many times was naloxone, Narcan, used. And remember last month we talked about naloxone, what it does when we go to these opioid overdoses. If someone's unconscious, we got like a nasal spray that we spray up in their nostril. Basically, what we found out, the police department had 37 incidents where naloxone was administered to an individual from an officer. 37. That was 37 calls for service. They went to a residence and/or a call, met with somebody that was having an overdose symptom and/or unconscious, and used Narcan. So then we took our statistics and looked from Morrison County. In that same time frame, we had 10 Morrison County deputies. And I broke it down. For us, it was 6 deputies used Narcan on individuals. 1 was up in our jail where a correctional officer had to use it on an inmate. Randall First Response Team used Narcan prior to a deputy arriving at a scene. And then 2 deputies who assisted the Little Falls Police Department used Narcan in the city of Little Falls. So that's our breakdown. So you can clearly see there's a problem. You can clearly see that we need changes. And that's not just here in Morrison County. That's our region, that's our surrounding communities, that's our state, our nation. It's everywhere. So I'm guessing there's going to be questions, so I'm just going to keep going through if that's fine. Social media, I just kind of talk about, like I did last month. We're still active on it. Again, we share success stories, we share warnings to people, whether it's weather related or some type of danger that they should be aware of. And we continue just to educate and throw material on our site as we see fit. Property watch, business checks, you guys as elected officials, if you get asked about these door hangers, there's a picture there. We have door hangers. So we'll go to a business in the middle of the night, whether it's 2 a.m, whether it's earlier at night, and we'll just hang a little door hanger on their business, and we'll just put our badge number and the date. And that's really just for business owners to know that, hey, deputy was by, he checked your business, he did a walk around, everything's secure, nothing to worry about. If there is anything to worry about, we'll notify you. But it's just a good thing that we're doing, and we're getting a lot of positive feedback. But I know sometimes I get emails from business owners saying, I got a door hanger, what happened? Was I broke into? What's going on? So just letting you guys know, and as we have the people that have called us, that This is just our guys being proactive and trying to check businesses in the middle of the night to make sure everything's secure. I could go on and on, but with that, I'll just open it up for questions.
Gentlemen, questions? Commissioner Wincher.
Thank you, Mr. Chair. Sean, with this Narcan, are they, again, I wouldn't want to be in your shoes at all, but when a deputy or yourself comes upon somebody that's passed out or whatever, they must have to diagnose this person and say, hey, is he having a heart attack? Or, they just can't administer the Narcan right away, so I'm sure there's always those challenges too.
There is, Commissioner. I think what we do is we kind of try and read the scene. If there's someone else that's calling, which is usually the case, they give us a little background of what occurred, because we're going to ask what led up to this, just like any medical, who, what, where, when, why. And once we get the information that it's potentially drug-related, we will administer Narcan. But a follow-up to your question is, we've been told that if we suspect it, and even if we're not right, we're not going to be doing any damage by using
That was my
Narcan.
question, that was where I was leading to. So you're not gonna do any damage to this person if you do administer the Narcan?
Correct.
All right. Thank you.
Yes, sir.
And Mr. Chair, if I may,
Commissioner Jelinski.
that truly is the beautiful part, if you will, as much as nobody wants to say it. It's the beautiful part of Narcan. It's the training that is given to the peace officer, which more than likely it's probably done through our Central Region EMS.
Correct.
Probably the Narcan's delivered by Central Region EMS to the law enforcement agency. But what it entails is the idea of exactly what you just got done saying. If I administer it and I'm wrong, it really wasn't, this person wasn't having an effect brought on by a drug, it's something else, it's not gonna hurt them. And that truly is the beautiful part. It's that erring on, oh, should I or shouldn't I? No, do it. And it's done. So I appreciate that. Thank you.
So Commissioner Jelinski, just to add to your comments, I think a lot of the stigma and a lot of the information in the past was that Narcan is a save-all. And we've actually heard from our drug task force officers that, when you deal with enough enough informants, and these guys are buying drugs and that's their job, they're directing an informant to buy and purchase drugs, they get stories and they ask questions. That's our job. And a lot of them will be up front and let them know that, hey, this is, with Narcan being readily available and easily accessible, there's been some drug parties, because we'll designate somebody to be the Narcan person. They'll stay straight, they'll stay sober, they won't use. And if we go down, they can revive us. And that's how bad it's been, and it continues to be. But in this little article, I talk about how Narcan has been administered, and it has been ineffective as well. So every day on the black market, there's different drugs coming across that we just can't control or predict, and that's what's happening. I think people, of course, the addiction's number one, and number two, they've always used Narcan as a crutch, and now it's not working, so.
And I agree with you, Sheriff. You've got that tool for the drug user. I've got a tool here. As soon as I go down, give me a shot, do whatever it is that I need to do. But the point of fact is that perhaps in the early days, if you will, it worked.
Correct.
Now we are where we are today, and it might work, but it might not. That's really what I think where we are today.
Yes, sir.
So, thank you.
Gentlemen, anything else? Otherwise, Sheriff, I'd like to ask you, maybe switch gears a little bit more to the legislative side of things. And you had mentioned early on about discussions with the Minnesota Sheriff's Association. And so going into this legislative session, that'll start here in another month, or less than that, actually, a couple weeks. trying to be able to respond to the residents here who have concerns about what can be done with this crisis that we have going on here right now with, and it really comes to light when we have, as you say, we have 2 fatalities from overdoses in the last 5 days. The public is starting to be more vocal about instituting change that the government or the powers to be have to take action. And I go back to 20 years ago when I was in St. Paul and the legislature took action that was pretty groundbreaking at the time to take pseudoephedrine off of the drugstore shelves and put it behind the counter to stop the manufacture of methamphetamine in the state, and was very effective. But now the pendulum's kind of swung to where, as you stated, the punishment doesn't seem to fit the crime anymore. And I'm wondering, is the Sheriff's Association going to take an aggressive stance with the legislature in asking for change in that part of state law and sentencing guidelines, and/or what can the counties do to help support to bring about some sort of change going forward? And I know I took you on a kind of a long trip here with my comments and questions there.
Yeah, good questions, Commissioner. To answer your first one, yes, the MSA will take a stance. We have a legislative committee, and Sheriff Tim Leslie, who's retiring from Dakota County, is jumping on that and taking the head of that committee. He's asked myself and others to testify, if you will, and present what's going on in our communities, and kind of explain why we're looking for change. So, yeah, we're at the point now where we're reaching out and we're trying to, number one, my email, I have phone access. I'm trying to get out in public, and everybody I see and talk to, and there's been a lot of phone calls coming in, a lot of people saying, I'm willing to come to the table and help, which is great, because now it's just a matter of, attracting everybody that can help and making sure we use everybody's strengths and do everything we can and be and to make sure that we're getting our point across. But, so yes, we have a legislative committee, and yes, we are strong on legislation changes, and we will be at the table and making sure our voices are heard. As far as county support, we've been having some meetings, and this was kind of set up. It started just a few months ago this last fall, and we have another one January 12th. It's at City Hall. We got like the mayor, the city administrator, this personnel from the Little Falls School District, I believe the superintendent. There's going to be the city, the county attorney, basically representatives from law enforcement, Stand Up For You Youth Coalition, and we're coming together as a group, public health, social services, the list goes on. Our county administrator will be there as well, and this is exactly what we're doing. We're talking about what are the issues, what are we facing, and how do we make a difference, but yet how do we work together and try and stop some of this. I know we can't stop everything. We're not going to stop the deaths. Unfortunately, we're not. Let's be realistic. But we can slow things down. Because I said from day one, if you want help, you have to be accountable, and you got to want help. And then that means everybody has to change a little bit then and kind of erase that stigma and quit being so judgmental. If these people want help, let's give them help. and let's make sure that they're successful. But that is going to take community support, and we're still working on that piece, and we do have this upcoming meeting. So I would ask that if any of you gentlemen as elected officials want to be present for that, it's January 12th, and I think it's a good day to make sure our voices are heard and work together as a team, because there's no one individual or one elected official that's going to solve all this by ourselves. So, and did I answer all your questions?
I believe you did,
Okay.
Sheriff, and you've provided us with some very important information here this morning. I'm hoping that the legislature will have the Sheriff's Association in their committee hearings to take testimony, and I think back 20 years ago and how important and how powerful that was to hear from sheriffs around the state who brought photographs, they brought information, they brought testimony on that methamphetamine epidemic at the time, the manufacture part of that. And that really made a difference in changing state law. At that time, I'm hoping we can see the same kind of action and result, hopefully coming up in this next legislative session.
Absolutely. Well, thank you.
Further, Commissioner Gillenson.
Mr. Chair, Sheriff, I just have one more thing. You said Sheriff Leslie, and I know Sheriff Leslie is retiring. Did the Sheriff's Association actually go after him and ask him to lead this? Or is he is leading, but now is getting off and it's gonna take new leadership?
So it'll be taking new leadership,
Okay.
but he's
Okay.
working side by side with our current coordinator.
Okay.
And we just learned our last MSA conference, which was December 6th, I believe, that week, that we're gonna have a new MSA director as well. And that'll be Sheriff James Stewart, who is a retired sheriff from Anoka County, or will be retiring at the end of this year.
Yep.
So,
Very good.
well,
Thank you.
good leadership in place.
Very good.
Commissioner Wilson.
Sean, I noticed you named a lot of people off. Do judges ever get invited to those things, or are judges not allowed to be able to talk about stuff like that because they're the ones that make rulings over stuff?
So, the organizer behind this is Little Falls, i.e. the chief of police of Little Falls, and I asked the same question, and he said, feel free to invite them, so we are gonna send them an invite, and we'll see if they come to the table. Good question.
Anything further for Sheriff Larson this morning? Sheriff, thank you.
Thank you.
For your time.
Merry Christmas, everybody.
Merry Christmas,
You
Sheriff.
too. Should we take, okay, we'll take let's take 7 minutes. We'll
Why
come
wouldn't
back
we?
at Gentlemen, I'm going to call the meeting back to order here at 10:18. Gentlemen, next on the agenda, we have a extension report. Becky is here this morning. Good morning, Becky. How are you today?
Good morning.
Morning, Becky.
Thank you for your patience with us.
No problem. You had some very important reports before me, and actually, listening to them, it kind of changed some of the things I was going to mention. I'll be honest, I always think of extension reports as kind of the feel-good report of the day.
It is.
We have, such good things to talk about. One of the groups, and I know I've mentioned it before, that's new, and it's a pilot program, and it's called the Change Makers. And Morrison County has 4 youth and 1 adult mentor, and the 4 youth are working on a project together. And so the Changemakers premise was there was a substantial donation that came in, and the different groups are developing something that they feel can positively affect their community and their support for that. So while a lot of youth and adults have great ideas, but the funding isn't there. And so this brings the 2 of them together. And there's been a little bit of connectivity issues, and so we had kind of a group meeting at the Extension office and Zoom call with the rest of the Changemakers group. And I was listening very intently because I hadn't gotten a lot of details on what our group was doing. I knew that they were kind of addressing substance use and abuse in the high school, and that was kind of all I had really heard. And so to listen to them, they've developed 2 different pamphlets that they want to get into the hands of youth in the high school. And one is about just kind of information about, substance use and abuse. And the other one is much more, when I looked at it, it's like youth friendly. And so it's youth telling youth that it's okay to ask for help. Here are some support areas. Here's what, you can do if you just ask for some help. And I was thinking about the other reports and some of the comments that the kids made. And one of them was they're scared to use the restroom in the high school because they're worried that if they go in there and someone comes by and smells or sees an illegal substance, they will be guilty by association. And I was really, shocked. I'm like, that's something people need to do every day, and they're afraid to do that. And it just really kind of hit me. And so the other things that they kind of discussed later was their fear that maybe getting these pamphlets into the hands of high school students is almost too late. And how sad to think about that. And so they're actually looking at maybe they can get these brochures into the middle school as well to address younger and younger youth who are getting involved in substances. So I was really proud of them. I think it was really enlightening to hear from them, and just so cool that they want to try, and that's what they want to address. They want to look at their peers and help them out. So I was really proud of them. I did also want to mention, on a more happier note, a meeting that I had here last night, and that was for a new group I'm trying to form called the Ag Ambassadors. And we currently have an ambassador program that is for youth in 6th grade and up. And the ambassadors, their program revolves around having fun, learning leadership, promoting 4-H, and doing service work. And so these Ag Ambassadors will take a little bit different spin on that program. And so the activities that they do, and one of the examples we talked about last night was our regular ambassador group may choose to tie blankets to donate to a nursing home or the hospital as one of their service projects. Whereas the Ag Ambassadors might look more towards some sort of agricultural service program. And so several spoke up right away and like, well, we could go out to the fairgrounds and we could, paint some of the buildings for them, or we could, and immediately they were thinking about what could we do in an agricultural way to support and serve the community. So that was really fun. And so they've kind of agreed that it's a good idea and we're going to move forward. So that was our inaugural meeting. We also talked about educational opportunities. The success of our auction has been quite overwhelming. And so the Action Committee has set aside dollars specifically for animal science education. And so we talked about what kind of things could we do, and what would you want to learn about, and what time of year could we do it. So I have a wonderful set of ideas to go off of, and I'm looking forward to spending that money on some good education.
Excellent. Mr. Chair?
Commissioner Jelinski.
I love the conversation on the change makers, and I want to just keep on that subject just for a moment or so. And I don't know that you were actually here, Becky, when Brad was here and Melanie were here from.
Talking about anxiety in youth.
Thank you. From Health and Human Services, you were here and listened to the sheriff. I
Yes.
know you heard the whole story. I would only hope, if they haven't done that already, that you would sit down with the change makers and say, have you talked to the local sheriff? Have you talked to any local police departments? Have you talked to any elected officials? Because there's support there. And actually, I believe you heard it today, there is support all over.
Yes.
And oftentimes, it's hard to open up a door. I get that. I absolutely understand it. It's hard to open a door. These are 4-H members, and they know that you have to open up a door. I get that. So please, if there's anything that they need there, there's other avenues that they can go. And I would anticipate that they have spoken with management at the schools.
Yes.
It frightens me to hear what you said, that someone, anyone, might be afraid to go to the bathroom because of guilt by association. Understood. I get what you're saying. But I would certainly hope that that group sat down or sits down or gets the opportunity to have a conversation with management at any of our schools to address that. That's a pretty big statement to make. I really don't feel comfortable going to the bathroom. What? That's huge. And I'm sorry that is out there, because they shouldn't be. They shouldn't be. But that's coming from a totally different generation. So please, I get it, I understand, and thank you for everything that you're doing with that. I appreciate it. That's all I have, Mr. Chair.
Well, thank you for that, Commissioner Jelinski, and I think it kind of underscores that thought that we want our children to feel safe anywhere within their school.
Absolutely.
And to be able to use for something as simple as being able to use the bathroom, or be able to walk down the halls, or feel safe in a classroom. I guess some of us look at that and maybe we're taking some of these things too much for granted, and this is why the importance of having Becky here to share with us this information to get us in on the know about these are some of the real things that are happening that aren't necessarily talked about. And we like to talk about all the positive things, and I still look at your report this morning, Becky, in very, very positive light. I agree with Commissioner Jelinski. Change makers, you're taking 4 youth and not just challenging them, but supporting them to be productive members of society, and to encourage that with their peers and those around them. And then certainly the Ag Ambassadors and the Ag Ambassadors program for this county. We are an ag county, and we know how important our ag youth are in this county, and the ability that they have to make a difference out there. These things don't happen, though, unless we have tremendous adult leadership and that comes from you. And I want you to know that this board does not take that for granted, and we don't take the work that you do for granted either. It is, it gives me great pleasure just to have you here, to be able to say thank you for everything that you do in making a difference into the youth in Morrison County, but also to making a difference to the parents of these youth also. And that gives me bright hope for the future here in Morrison County. So
Thank you.
thank you, Becky.
Thank you.
Gentlemen?
Nope, I'm good.
Merry Christmas.
You all as well.
Thank you,
Merry
Becky.
Christmas,
Thank you.
Becky. Thank you.
Gentlemen, we have our Public Works report. Good morning, Tony.
Good morning, Mr. Chair. Good morning, Commissioners.
Tony, good morning.
I've got have a handful of items here this morning. It's kind of a precursor to some of the things the administrator and some other folks will be talking about shortly. Our first item today is, I'm asking for authorization for a resolution supporting a 2027 federal transportation project submittal. So this submittal is an application for a federal grant to help maintain our CASA 46. It'd be a construction project in 2027. You know, and when we talk about budget, these grants are some of the things that support our public works budget and supplement it. So this would be outside funding that we're hoping we'd get selected for and be able to utilize on that project.
Wishes of the board?
So move, Mr. Chair.
Second.
We have a motion by Commissioner Lemire, a second by Commissioner Wilson. Discussion. Commissioner Jelinski.
Mr. Chair, Tony, I would ask that on our description here, it says authorized resolution supporting the 2025 federal transportation project submittal.
That is the next one.
Very good. Excellent. Thank you. That's all I needed.
Any further discussion? Any further discussion? Seeing none, gentlemen, it's a roll call vote. Commissioner Lemire?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Wincher? Aye. Commissioner Wilson? Aye. The chairman votes aye. All those voting in the affirmative, this resolution passes. Mr. Hennon?
Mr. Chair, so our second one here is to authorize a resolution supporting a submittal for the 2025 federal transportation project. This would be our County Road 203. So what happened is usually we're submitting these applications for funds typically 5 years in advance, hence the first one, 2027. With the IIJA, there's some additional funds that are getting distributed. And the way Region 5 handled some of that is there were some counties that were advancing funds, and what we did is we essentially shuffled the deck, utilized those additional funds for those advanced projects, and now they're encouraging us to put in additional applications to solicit some additional funding that's been made available. So usually we only do one of these applications, but since there's more money available, you know, we'd love to see it in Morrison County, so that's where I'm asking for that resolution to support this project application.
I'll move on this, Mr. Chair.
Second.
We have a motion by Commissioner Jelinski, a second by Commissioner Lemire to approve of this resolution. Discussion? Discussion? Discussion, seeing no further discussion, gentlemen, it's a roll call vote. Commissioner Wincher.
Aye.
Commissioner Wilson.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Lemire.
Aye.
The chairman votes aye. All those voting in the affirmative, this resolution passes. Mr. Hennon.
Mr. Chair, our third item today is a request to authorize resolution prioritizing our bridge replacements of deficient bridges. We update this list every year as we are able to take some of the bridges off the list, or in this case, we added a few. In 2022, we had three box culvert replacements that were actually on this list. You know, so 3 came off this upcoming year. We did our inspections this fall. We ended up adding a couple of bridges. So what we do is we use this replacement list for when we're submitting applications for bridge bonding and just prioritizing these bridges to make sure we're providing a safe infrastructure for our traveling public here in Morrison County.
Make a motion to approve, Mr. Chair.
We have a motion by Commissioner Lemire, second by Commissioner Wincher to approve the bridge plan here for the next 5 years as is shown in front of us. Discussion. Seeing no further discussion, gentlemen, this is a roll call vote. Commissioner Lemire? Aye. Commissioner Wilson? Aye. Commissioner Jelinski?
Aye.
Commissioner Wincher?
Aye.
The chairman votes aye. All those voting in the affirmative, the resolution passes. Mr. Hennon?
And our fourth item here is a request to authorize resolution to execute the agency agreement for federal participation in construction. So what this does is it allows us to utilize the funds that, for similar applications, what we just did resolutions for, to actually utilize the funds this year. So what this does is it allows the Commissioner of Transportation of Minnesota to be appointed the agent for Morrison County to accept these federal funds, and then they're distributed to the county for use. For 2023, we have a number of federal projects that we received grants for. You know, one of the larger ones is our CASA 1 project from Randall up to CASA 5. Another project would be our CASA 6 bridge over by Sobieski. Then we have some smaller projects that are countywide, our highway safety improvement project, a striping project, and then we also received funds for a Chevron project coming up in 2023. So this resolution would authorize the state of Minnesota essentially to send those funds to
So moved.
Morrison County.
Second.
We have a motion by Commissioner Wincher, a second by Commissioner Jelinski to approve of this resolution. Discussion? Oh, Commissioner Wilson.
The discussion I have is that we talked about all these at Public Works
Yep.
before they were brought here today, that we're not talking about them, so.
Yep, thank you, Commissioner Wilson. Anything further? If not, gentlemen, roll call vote. Commissioner Jelinski?
Aye.
Commissioner Wilson? Commissioner Wincher?
Aye.
Commissioner Lemire?
Aye.
The chairman votes aye. All those voting in the affirmative, this resolution passes. Mr. Hannon, anything else?
I have one more item, not on the agenda. It's more of a selfless plug for Public Works. You know, so we're looking at our 2023 construction season, and every year we bring on engineering interns or seasonal engineering help, or try to. You know, last year we were able to get one student to come work for us. So we're starting the job postings a little early this year for seasonal engineering interns or seasonal help. So I would just like to, you know, mention that, and maybe Zach puts it in the paper there. In addition to our other advertising, you know, it's an opportunity for students that are interested in engineering to come work with the Public Works Department, be out on our projects and working with our staff. They receive a little bit of education by working with us, and we receive a little bit of additional help. So it's a nice little program, so just kind of a selfless plug there. And, you know, we're fortunate to have Sourcewell in the area. This is one of the items where Sourcewell helps support this program. So they provide reimbursement for the counties of Cass, Crow Wing, Todd, Wadena, and Morrison County for some of these engineering internships. And if we had a couple successful applicants, we'd be putting in to receive those funds as well.
Well, thank you, Mr. Hennon, and thank you to your staff for being tremendous mentors to these interns, and obviously that we do receive some in-kind help from those internship programs, but it also certainly gives Morrison County the opportunity to put our best foot forward out there with these young engineers out there. I also want to mention too, before I go to Commissioner Jelinski, this board's appreciation of you and your staff's efforts here in the past week in the in our first challenge of winter weather here too, and I've received a couple of calls from constituents out there noting or asking me to note their appreciation to you and your staff for the tremendous response that you guys have had and the great work that your guys have been done, and they've been taxed in repeated days to respond here with the last storm, and we know this this won't be the end of winter for this year, and we will see this more and more, but just wanted to take that opportunity. My good friend Commissioner Jelinski, you wanted to state.
I did. Tony, thank you, first of all, about talking about future employees of Morrison County. What grade, as long as Zach is here and doing the story, what grades, what schools are we talking about drawing from?
So for this kind of position, the seasonal engineering or an engineering intern, you'd be looking at high school seniors that are interested in the engineering field. And then they'd be hopefully enrolled in the fall to move in to start studying that. Or students that are at either a tech school looking at engineering or possibly a four-year school. You know, in the past, we've had some from, St. Cloud Tech, we've had some from NDSU. A couple of years ago, you actually had a student that was attending Texas Tech. So it's a unique opportunity for students in the area that are going into engineering to come see what it's about, at least from the public sector.
But if we have a high school senior in any of our Morrison County schools, certainly would be available to make application.
Absolutely, yeah. If they're interested in the engineering field and that's what they're intending to do, later on in the spring, we'll start doing our seasonal maintenance workers. So maybe if a student or someone else is undecided and they would like to do something for the summer, they can come work in the maintenance department as well. What we're advertising now is specifically for the engineering department. So we're trying to gear it towards some of those students that are going down that career path.
I'm not positive, but Zach might be calling you later on today. I'm just not sure of that. Thank you, Tony.
And one last comment or question.
Commissioner Wincher.
These, engineering future, do they get paid for this position?
Yes, this is a paid position. It's a grade 10 on our pay scale, so anywhere from $14 to $18 an hour. We'll probably be advertising around the $14 to $15 range.
Just wanted to help you out with Zach there to say, hey, this is a paid position.
Paid position. We'll be getting it out advertised. We'll be advertising the record as well as at the tech schools and the engineering schools. So I just wanted to have that plug and say thank you for everybody, and hopefully students in the area consider it.
Thank you.
Thanks, Tony.
Thank you, Tony.
Thanks, Tony. Merry
Thank-
Christmas.
Yep.
Merry
Merry
Christmas,
Christmas,
Tony.
everyone. Thank you for the kind words to the staff. Morrison County is just so privileged to have very hardworking people on our maintenance staff to do our roads, and I'm very fortunate they work for me. It makes me look good. So thank you. I'll pass along all the kind words. Merry Christmas, everyone.
Thank you.
Yep, thank you, Tony. Gentlemen, I look to Mr. LeBlanc, our administrator here.
Thank you, Mr. Chair. I'm going to call Kurt forward so we can discuss one more time our 2023 budget and proposed levy with the board.
Morning, Mr. Chair. Good morning.
Good morning,
Commissioners.
Kurt.
So the first item I have on the agenda today is a request to approve the 2023 budget and levy. The following attachment has the breakout between the funds. The request is to have a separate motion for each. So a separate motion for the 2023 levy and a separate motion for the 2023
Mr. Chair,
budget.
Commissioner Lemire.
I'll make a motion to approve the 2023 levy.
And I'll make a second for more discussion.
We have a motion by Commissioner Lemire, a second by Commissioner Wincher to approve the 2023 levy. Discussion. Commissioner Wincher?
Again, this was, boy, how time flies. What was this, last week or 2 weeks ago? We had the truth in taxation already. And we had some participants in there, so again, we don't take this lightly. I can't remember which one of us mentioned, though, we started at in the 12s, 14s, somewhere for a levy, and thanks to the staff and yourself, Kurt, to get this down to the X amount where we're gonna be coming at. And I say, this is something we don't take lightly. I think we've been talking about this. Normally, it takes about 5 to 6 months. We continue, looking at where the money's well spent, and I think this board did a great job of bringing in what the levy's gonna be.
For the discussion, Commissioner Lemire?
I'll just say, I'll add on to that, we had many meetings on this, and we had people that needed more individuals in their departments that we said, no, that we can't afford them right now. And one of the biggest, of course, is labor prices, which are contracts, which we can't go back on our contracts. And with the high increase in fuel and road products, that was another big inflationary increase that we received that, unfortunately, but yeah, we have to pass that on. I don't like the 5.9, but that's we worked diligently to get it there. It started at a 12.6, I believe, and we got it to 5.9. Thank you to Matt for all his hard work and for Kurt for all his hard work and all the department heads. That's one thing that's unique, I think, about Morrison County compared to other elected positions that I've held is our department heads are fiscally responsible. They don't come here with a huge blown out budget. They come here with the best budget that they can possibly come with, you know, and unfortunately, like the sheriff's department, and public works department, then the high increase in fuel costs drove up their budgets. And if we want to continue to have safe roads, if we want to continue to have public safety, this is where we're at. Thank you, Mr. Chair.
Thank you, Commissioner Lemire. Further discussion? Further discussion? Well, gentlemen, I'll just note, you know, today is what we've heard and reviewed in this morning's board meeting with some pretty sobering statistics of some of the challenges that are going on that have to be responded to by law enforcement, by our Health and Human Services Division, to also lets us know that we have, even though the major driver for our 5.95% levy increase is inflation and inflationary items, this board in the future, in 2023, will continue to have challenges that we have to address to provide for the health, safety, and welfare of the people of Morrison County. And I agree with you, Commissioner Lemire, that our department heads have always taken a very conservative and fiscally responsible approach in coming forward with their budgets. But I think it's also fair to say that they also understand that leadership from the board in this county has also done the same, that we want to be accountable to the taxpayers here in Morrison County about addressing the needs to, as I said before, ensure the health, safety, and welfare of the people of Morrison County.
Well said, Mr. Chair.
Any further discussion? If not, gentlemen, this is roll call. Commissioner Wincher? Aye. Commissioner Wilson? Aye. Commissioner Jelinski?
Aye.
Commissioner Lemire?
Aye.
And the chairman votes aye. All those voting in the affirmative, the levy for 2023 will be set at 5.95%. Kurt?
Mr. Chair,
Yes.
I'll make a motion to approve the 2023 final budget.
I'll second it.
We have a motion by Commissioner Lemire and a second by Commissioner Jelinski to approve setting the county budget. I will ask at this time for comments. Otherwise, I would like to give the opportunity for Mr. Bernarski, if you would like to address comments to the budget.
Nothing new since the public hearing held on December 8th. On that second page there, you can see at the bottom, we have the breakout between all the funds. And then for 2023, it comes to $56,749,000, and that's up just over $2.5 million from 2022, which the budget was set at $54,078,000. So it's an increase of 4.94% there.
Gentlemen, discussion. Discussion,
Mr.
any
Mr.
discussion?
Chair.
Mr. LeBlanc?
Just one other point, and so obviously there's a difference between the $21 million levy that was just approved by the board and the $56 million budget that we're asking to be approved by the board. The difference of the $35 million is in that state and federal grant monies and offset monies that the county does receive, primarily in Health and Human Services and Public Works, to be able to do those projects, and that's where those sources from those funds.
Thank you, Mr. LeBlanc. Further comments? Further comments? If not, we have a motion and a second to approve the budget of $56,749,045, or a 4.94% increase over 2022. Gentlemen, it's a roll call vote. Commissioner Wilson?
Aye.
Commissioner Wincher?
Aye.
Commissioner Lemire?
Aye.
Commissioner Jelinski?
Aye.
The chairman votes aye. All those voting in the affirmative, motion prevails. Mr. LeBlanc.
And I'll give it back to Mr. Bernarski, Mr. Chair.
Next thing I have on the agenda is the request approval for the 2023 Morrison County fee schedule. A public hearing was held on December 8th to discuss these fee changes, and no one from the public had commented on the changes. And
So
then
moved, Mr. Chair.
We have a motion by Commissioner Lemire,
Second.
a second by Commissioner Jelinski to approve the Morrison County fee schedule for 2023. Discussion. Discussion.
Just to reiterate that we've had multiple discussions on the budgets and the fee schedules and the levies, and this is another one that we've had multiple discussions about. I didn't hear there was no negative comments at our public hearing on the fee schedule, nor did I receive any comments via email or phone or face-to-face.
Yes, and thank you, Commissioner Lemire, and I heard no feedback or response from the public at all to any of the very minor adjustments to the fee schedule for 2023. Commissioner Wilson.
You know, looking at fee schedules, all the research we've done, most of our fee schedules are cheaper than most counties. You know, when it comes to landfill and everything else, what we have in our fee schedule, we look at what other places are charging and this and that, and the majority of the time, we're on the low end of that, and then we do that for our residents. So I just want to make that a note.
Yep, very, very good point. Thank you for that, Commissioner Wilson. Any further discussion? Any further discussion? We have a motion and a second to approve the fee schedule. Gentlemen, it's a roll call vote. Commissioner Wincher?
Aye.
Commissioner Lemire?
Aye.
Commissioner Jelinski?
Aye.
Commissioner Wilson?
Aye.
The chairman votes aye. All those voting in the affirmative, the fee schedule is approved. Kurt?
All right, the next thing that we have on the agenda is the request to approve the 2023 final levy for the HRA, and that was a $40,000. It's the same as the 2022 final levy.
Make a motion to approve, Mr. Chair.
Second.
We have a motion by Commissioner Lemire, a second by Commissioner Wilson to approve the HRA final levy of $40,000, which is a flat with the 2022 final levy. Discussion. Discussion. Seeing no further discussion, gentlemen, it's a roll call vote. Commissioner Jelinski?
Aye.
Commissioner Wilson?
Aye.
Commissioner Lemire?
Aye.
Commissioner Wincher?
Aye.
The chairman votes aye. All those voting in the affirmative, the levy is set at $40,000. Mr. Bernarski?
Next on the agenda is a relatively new acknowledgement of the debt service levy. This was first done last year as a recommendation from the state auditors to have the motion to approve, I guess, acknowledge the debt service levy as the portion of our total county levy.
I'll make a motion.
We have a motion by Commissioner Jelinski and a second by Commissioner Wincher to acknowledge our debt service levy. Discussion. Commissioner Wilson?
This is the money that we borrowed for our courthouse remodeling, right?
Yep, correct, yep,
And that's the only debt we have?
yes.
Yep, okay.
Thank you for that, Commissioner Wilson. Commissioner Lemire.
The last sentence, the planned use of excess debt service fund balance is sufficient to pay this scheduled debt? Does that mean that we have enough to pay that debt off if we have to?
Basically, not the whole entire amount. Basically, we levy so we can pay the following year. So we collect it one year to pay the next year. So that's what that means.
Okay. Thank you for that, Kurt.
Yep, no
That makes
problem.
sense.
Further discussion? Further discussion? Seeing none, gentlemen, it's a roll call vote. Commissioner Lemire?
Aye.
Commissioner Wilson? Commissioner Wincher?
Aye.
Commissioner Jelinski?
Aye.
The chairman votes aye. All those voting in the affirmative, motion prevails. Mr. Bernarski?
And that is all I have.
Thank you.
Thank you, Kurt,
Thank
for
you.
everything.
Kurt, thank you. Lots of work. Thank you very much.
Have a Merry Christmas.
Merry Christmas.
Merry Christmas to you.
Mr. LeBlanc, back to you.
Thank you, Mr. Chair. Gentlemen, I believe I do have a couple items. The first is to come back to the board once again in reference to the HAVA grant. And the HAVA grant is the Help America Vote grant. And if the board recalls, January, I believe it was 18 January of this year, we first heard about this grant. And the county was notified that we could receive $20,000 and an additional .287 cents per voting resident in grant money. The county did receive that grant money in the amount of $27,455.11. That includes our $180 of interest. So as that program went out throughout this year, the past 11 and a half months, the result of it is that there are additional monies available. And whether that was other counties not using their funds or some type of a calculation, but the result is our Auditor Treasurer Office received notification this past week that an additional $4,286 are available to Morrison County. So today I'm coming to the board to ask for the board's authorization to accept this HAVA grant dollars. Those grant dollars last year in January were to be applied for security, to assist voters, for emergency backup, and all of the programs to assist in the voting program. Of that money that we received, a good portion of it went to our Omni ballots to assist our voters, as well as through the Vega grant. With that, we had a match fund with the state of Minnesota on that Omni ballot, and the county had to use $11,000 out of our election reserve to pay for that. The proposal from the Auditor Treasurer's Office is to use the $4,286 to reimburse our election reserve funds. So that is what I'm here for today.
Wishes of the board.
So moved. You need a motion?
Second.
We have a motion by Commissioner Wilson, a second by Commissioner Wincher, to approve acceptance of this HAVA grant, additional HAVA grant money. Discussion? Discussion? Seeing no discussion, gentlemen, we'll do a roll call. Commissioner Wincher?
Aye.
Commissioner Wilson?
Aye.
Commissioner Lemire?
Aye.
Commissioner Jelinski?
Aye.
The chairman votes aye. All those voting in the affirmative, motion prevails. Mr. LeBlanc.
Thank you, Mr. Chair. And we'll get to the next item, which I believe is committee reports. And we're going to discuss the first week of 2023, January 1st through January 7th.
Well, I know who bats lead off. Commissioner Jelinski, grab a bat.
Here we go. January 3rd, 9 o'clock in the morning, County Board. January 5th, 10 o'clock in the morning, State Emergency Communications Board Legislative Committee. That one's going to be virtual. January 6th, Friday, 8:30 in the morning, TSWAC at the landfill. To the best of my knowledge, Mr. Chair, that takes care of the first week of January.
Commissioner Wincher,
Covered me.
Got me.
we're golden. Commissioner Jelinski, another base hit. I love it. Mr. LeBlanc.
And if memory recalls properly, the last item that I would ask is that we move into a closed session where I can receive my annual evaluation in accordance with Minnesota State Statute 13 Delta 05 Subdivision 3 Alpha. And that is our last business here on today's
I'll
agenda.
make that motion.
We have a motion by Commissioner
Second.
Lemire and a second by Commissioner Wilson that this board would go into closed executive session. All those in favor signify by saying aye.
Aye.
Aye. Those opposed. We are in executive session.
Take a break.
We'll take a break.